get to here, and I'm going to go ahead and make this big for all of us. It says click icon to view levels. So you can right click here, and that will also take you to that same spreadsheet of integrated care that we just looked at. So here's another place for it. So to go over this in a more simpler fashion, when you're looking at patient-centered care, and that's the goal. You want your patient to be the center of care, and you have these integrated, coordinated systems that interact to ensure patient-centered care. So it talks about it can be an integrative style, shared care, collaborative, coordinated, or co-located, which comes right off of that chart, just like we talked about. But you are taking a medical system of some type and integrating it with other systems that are behavior or mental health. Now, those could be primary care, addiction services, home health services, or behavioral health services. But you are meshing in some way medical and mental services under the same system in some way, depending on which level of care you chose. Now, remember, your role is the administrator. This is your agency. This is the agency that you have designed. This is the agency that you said, this is who we are. This is who we're going to serve. This is what we're going to do. These are the employees I'm going to have. So what are your responsibilities to that design? One is you've got to know and follow your policies and procedures. You have to have ways that things run, way that things connect together, ways that ensure that what you're liable for, things that ensure how things are going to be maintained. How is record keeping going to happen? Who is going to monitor that people document correctly and timely? Are you going to have people that are specifically designated for grant writing to have additional programs? How do you communicate with the community, with all the different other agencies that are not under your umbrella? What about when needs arise and you need to grow? How are you going to do program development? Do you have a team? How do you ensure that what you're doing is done correctly and ethically? Those are the things we're going to talk a lot about in this section coming up. So, developing strategic plans. So that's where we want to start. That's what your discussion board is really focusing on is these strategic plans. So start with why we want integration of care anyway. So let's think about this. Do you think it's possible to have a chronic or acute or terminal illness, medical illness, and it not impact your mental health? Do you think it's possible to have severe mental health issues like depression that is disabling and it not impact your physical well-being? We have a decent understanding about comorbid and co-occurring disorders, and most of the time we focus that on mental health and addiction, putting that together. But what about our medical? What about how depression and anxiety comes from maybe something that we've been diagnosed with from a physician, or having to deal with aging in different ways, or trying to manage medical symptoms, and it becomes frustrating. So this can work back and forth so many ways, but evidence shows that when we combine these two, we not only reduce costs, but the most important part is we improve delivery of services in people's lives. They get better care, bottom line. So let's talk about how this is going to happen. These are the primary competencies that are needed from the administrative people that guide integrative care. So we're going to talk about all 6 of these as we go through here. Let's start with interpersonal communication. In order to have interpersonal communication, it is not a dictatorship. You are actively listening. You have to be able to jump in, gain people's trust, be able to do your job, be able to communicate effectively, but also listen. You don't use a lot of jargon that nobody understands what you're talking about. You don't judge people that you're talking to. You use the terminology for the people that you are talking to. So you don't use acronyms for medical staff that they don't understand because that's mental health acronyms. You recognize the people that you are speaking to. You recognize that you need to communicate with those individuals, whether they're staff, whether they're professionals, whether they're stakeholders, resources, or community people that you're actually providing the services to. You have to be able to relate to anyone that you're talking to. But you also have to recognize that you need to listen, and that being a very big key there. You also have to recognize your own biases. Just like as a clinician, we have to recognize things that we have assumptions about that may not be accurate. So recognizing and managing personal biases, whether that's about the community, whether that's about a population, whether that's about a medical illness, we need to recognize our own issues when we work with everybody. The second thing is collaboration and teamwork. We can only provide services as well as our team functions. So the more communication that we have, the more that we realize that each person has a role and they are experts in their own role, then the better that we can communicate and respect each other's role in providing services to the client. Recognizing that that's not our client, as far as my client, your client, that it's a shared client, and that we share different roles and responsibilities as part of providing services for that client. And if you're running this agency, what kind of things can you do to help with the communication, to help with the shared system of a client, to make sure things are getting delivered, things are not being duplicated, things are actually being communicated in an effective way, and we're not letting things slip through the crack. The other parts of teamwork is advocating, fostering shared decision making, having a warm handoff. We kind of talked about that in the last module. Having a system to where one person, when they're done with the appointment, they take them to the next one. So people aren't spending 90% of their time out in the waiting room. What is the ability to be flexible, adaptable, ready to change? What's the ability to respond to things that have to happen immediately? What kind of outcomes do you want for the people that you're serving? And how do you make a team that's designed to communicate and effectively deliver those outcomes? Screening and assessment, that is important in mental health, but it's also just equally as important in medicals. So the medical world and mental health, you've got different things that you're going to be screening for, whether it's their developmental, the orientation, whether it's diagnostics, whether it's blood pressures, support systems, screening for abuse, suicide. There's just all types of screenings. Who does that? Whose role is that? How does that work? Where's that information kept? And what is the process for that? Those are all roles that an administrative person would have to put into a policy, procedure, and outline. So this just gives you some ideas of some of the technical side of what a lot of times we don't really think about, because we are usually working on the clinical side of it and not designing the actual rollout of these type policies and procedures. Care plan and care coordination. Not duplicating services is probably one of the biggest ones. Is you want to make sure that people are doing what they say, people are following through, people are linking services where needed, they're identifying holistic care, recovery, wellness, um, education, matching the level of care with the level of need, um, not putting someone into services that they don't need or billing for services that are not required. Even the collaboration with how to schedule clients and bring them back in for services. How do clients know how to navigate through the system of care that they're currently in? How do they manage the symptoms that they're doing? All of these things are about care coordination. Okay, let's go to the next slide. Oops, I think I went through one too many. Okay, here we go. That leads us to intervention. What types of interventions does your agency need to provide? Motivational interventions? What about holistic care, promoting better health, better wellness, ways to take care of yourself, whether that's mentally or physically? Education? What about when people get acute? Do you have crisis intervention services? You could also have brief interventions, things that are just one or two classes. Somebody could come and just get general knowledge of how to deal with anxiety, or general knowledge of how to be a member of a family that is dealing with an addiction, or a member of a family that's dealing with a severe mental health person. Or, hey, this is a dietary class that talks about symptoms like you experience with ADHD, and what are better foods for people that experience ADHD symptoms, or diabetic food classes. Brief interventions that could be just something that you could support the community with. And then you also have systems, not systems. Then you also have maybe educational type things, or programs for medication assistant programs, which is primarily like for addiction. And then you have the responsibility of cultural and diverse competencies. How will you ensure that all these people that you have hired that are serving all these people in the community are educated? They understand the disparities. They understand how to adjust things for clients if they are not, English is not their first language, if they need an interpreter, if they need education in some way that maybe most people would assume that you know, connections and resources, advocacy, respecting their difference of needs, their difference of beliefs, their difference of opinions, whatever that means. How do you ensure that the people that are serving them have the competencies to work with the diversity that they're serving? Next, we have system-oriented practice. So a system-oriented practice is just like when we think about like client care and we talk about a systemic view, we talk about the interconnection. So your organization structure is just as much a system as a family is. And so how do we make sure that people are educated, that that we make cost-effective decisions, that we are changing with the system that we're connected with? There's going to be changes in politics, changes in rules, federal payer sources that we have to conform to in order to get payer sources to pay for the services we're providing. Sometimes it might be, I don't know how many of you guys are familiar with, there was a time when you didn't have to be licensed to provide therapy. And then it kind of went to well, you have to have a bachelor's degree, but then you have to be grandfathered in. Well, payer sources made the decision, no, you have to be a licensed therapist, you have to at least have a master's degree, and you have to go through the state requirements, or we're not going to bill for therapy. This is just one example, one small example of, as an administrator, these changes don't occur overnight. They are posted out there. They are saying this is going to be implemented at this date. You have until this date to make these changes. When those things happen, we have to anticipate those needs, and we have to adjust accordingly and prepare to make those changes. You don't want to wait until they happen and then to come up with a plan. You always have to, as an administrator, be looking at the changes that are coming down the pike, making sure that the training, the coordination, the coverage, all the things of the people that you serve are being monitored and regulated and served at the way that you can keep your doors open to continue that care. Practice-based learning, quality, and quality improvement. You never stop assessing. You're always going to have specific goals for the employees that you have, whether that becomes like an individual thing, but also each of the programs and teams that you have. You have to be able to measure, you have to develop some type of goal. You have to be able to measure that goal, just like a treatment plan. So it's a facility treatment plan, if you will. You've got to figure out where the barriers are, figure out how to assess it, make goals, and then you want to take the things that you find out and make positive changes, make things easier or better, or just improve in some way, because that's what quality improvement is. It's assessing, making a goal to improve something. Once you meet that goal, then you continue to do that. You continue to monitor and assess things and continue to improve. You start with the priority stuff, but you never stop. You never want your agency to stop changing and getting better and better and addressing the issues that's there. Technology, electronic medical records, the ability to have a really good, user-friendly medical record that is a shared record that you can get away from a lot of paper is just a smart thing to do, because when you have multiple providers putting the information in that it's for a shared client, it's an incredibly important thing to have that information at your fingertips. Technology has become more required, like electronic medical records, having safeguarded systems, security systems. Those type things have become more of a requirement through medical and mental health services. And telehealth is starting to grow as well. And so, it wasn't until COVID that there was an allotment for a lot of the services to be able to provide those in a telehealth style setting. Now people can see their providers, even case managers, even people working within the school systems and prescribers, all through virtual appointments. And that really allows for services to be so much more provided than we were able to 5 years ago. And the thing that COVID really pushed for telehealth was there was the ability for prescribers and some therapy to be done through telehealth systems, but there was services never before provided through telehealth and able to be billed for that was pushed through COVID, that really allowed for a much more broader way to do telehealth. And it also provided a lot more training in how to do telehealth than we'd ever had before. So if telehealth is an option that you want in your facility, what kind of things would you need to ensure are going to be there for your clients, for your providers, whether that's privacy, whether that's a platform, security, confidentiality, all those different things have to be a strategical plan that's put in place in order to happen and happen effectively. As a quick review, we want to provide person-centered team care. Your client is in the middle, all the providers are on the outside, and the client is the center of care. You want to make sure that the agency has a system that where everybody is in one system so nobody falls through the crack. You want to make sure that it's being measured, that you make changes to meet the goals of what you've set. You want to make sure that what is being delivered is evidence-based care, and that your providers, your clinic, your employees are all accountable to that person-centered approach. And here are some additional YouTube videos. Now this one right here, if I was going to suggest one that you might have a chance to watch, is Daniel's story. And Daniel's story is about a client that was willing to be interviewed, and it showed before he was put in integrative care, and it shows him talking about how things changed and improved for him after he was started being seen in an integrative agency. There's a couple other videos here on YouTube that talks about integration of care if you've not fooled much with it. But I think today more and more people you'll see are using integrative care. Even a lot of small doctor's offices or clinics will have at least some therapists or case managers for the people that they see. So those are kind of examples of integrated care. They can work both ways. They can start out as a medical, or start out as a mental health facility, or just be developed all in one as an integrated care system. But it doesn't matter kind of like what come first. It's about designing a system where the client is first, and designing a system to where you are providing services in a holistic way and the client is in the center of the care. And that's the most important thing. So I hope some of this information will help you with your discussion board. If you have any questions, please let me know. Thank you.